Hi, new graduate physiotherapists. It is great to have you joining us today for this in-service to learn more about chest x-rays and interpretation. Chest x-rays are useful for physiotherapists and other health professionals to discover the condition of a patient's lungs and heart. This can help guide us in our management of the patient. Chest x-rays also help us to educate the patient about the condition they have and therefore why physiotherapy is important for them. As you may already know, chest x-rays can be taken from either an anterior to posterior AP or a posterior to anterior PA point of view. A posterior to anterior projection is typically the most common and preferred type of chest x-ray. PA refers to the direction in which the x-ray beam travels. X-ray beams hit the posterior part of the chest before the anterior part. The patient is required to stand up with their chest against an X-ray plate. This may not be suitable for patients who fatigue easily, who are in a lot of pain, or who are too unwell to stand up. The AP chest X-ray is normally less preferred because the image of the heart and mediastinum is less clear and focused on this projection. The AP X-ray can be done with the patient in supine, and the advantage of this is for patients who are unable to stand up because they are very unwell or have worsening symptoms. In our case, Anna's X-ray is performed in the AP view because she fatigues quickly and has severe chest pain. Now, let's interpret Anna's chest X-ray. I have noted down my interpretation, which I will explain my reasoning to you. So in the blue here, there is patchy opacity and consolidation in the right lung and slight opacity and consolidation in the left middle zone, where it is likely that an air bronchogram is present in the orange. There is focal opacity and consolidation in the left lower zone, noted in the red, and slight tracheal shift towards the right side. Silhouette signs I've placed in the yellow here on the border of the right side of the heart and the right hemidiaphragm. Down at the bottom, there's a loss of the cardiophrenic angle, which is here in the purple. If you can see that over here. From this interpretation, we can say that it is likely that Anna has developed aspiration pneumonia, considering the symptoms she has as well. It is common for patients with Guillain-Barré syndrome to develop aspiration pneumonia due to upper airway compromise and muscle weakness. When this happens, a patient may not be able to clear secretions effectively and may have poor airway maintenance. Thanks for listening, everyone, and I will send you a copy of these slides as soon as possible, and I hope it helped you to have a better understanding of chest x-rays and when to interpret them, and a little bit more of a structure in the way that you interpret as well. Have a nice day.